I questions 4. 21. The client arrives in the emergency room with penetrating eye injury from wood chips while cutting wood. The nurse assesses the eye and notices a piece of wood protruding from the eye. What is the initial nursing action? 1. Remove the piece of wood using a sterile eye clamp. 2. Apply an eye patch. 3. Perform visual activity test. 4. Irrigate the eye with sterile saline. The correct answer is 3. Perform visual activity test. 22. The nurse is preparing to perform a Weber test on a client. The nursing obtains which items need to perform this test. 1. A tongue blade. 2. A stethoscope. 3. A turning fork. 4. A reflex hammer. The correct answer is 3. A turning fork. 23. A nurse is conducting health clinic for glaucoma. A client reports to the client for an eye examination and the nurse performs tonometry test on the client. The result of the test indicates an intraocular pressure 24 mmHg. Based on this finding, what information would the nurse provide to the client? 1. The pressure is normal. 2. The pressure is low. 3. The pressure is elevated needing follow-up treatment. 4. The test will need to repeat because the findings are inconclusive. The correct answer is 3. The pressure is elevated needing follow-up treatment. 24. A nurse is conducting a health screening clinic and is preparing to test visual activity for a client using Snell chart. The nurse instructs the client to stand at distance of 1. 10 feet from the chart and cover the left eye. 2. 20 feet from the chart and cover the left eye. 3. 30 feet from the chart and read the largest line on the chart. 4. 40 feet from chart and read the largest line in the chart. The correct answer is 2. 20 feet from the chart and cover the left eye. 25. The client arrives in the emergency room after sustaining a chemical eye injury from a splash of battery acid. The initial nursing action is to 1. Begin visual activity testing. 2. Irrigate the eye with sterile normal saline. 3. Swab the eye with antibiotic ointment. 4. Cover the eye with a pressure patch. The correct answer is 2. Irrigate the eye with sterile normal saline. 26. The home care nurse is visiting a client who has diagnosed recently with a hearing impairment. The nurse prepares to instruct the client's spouse in which measures that will facilitate communication. 1. Speak frequently to the client to provide sensory stimulation. 2. Speak loudly to the client to facilitate hearing. 3. Speak in a normal tone and face the clients when speaking. 4. Speak directly into the impaired ear to facilitate hearing. The correct answer is 3. Speak in a normal tone and face the client when speaking. 27. An older client with diabetic mellitus complains of blurred vision and difficulty reading and driving at night. Based on the client's history, the nurse interprets that the client probably is developing 1. Detached retina. 2. Papillarema. 3. Glaucoma. 4. Cataracts. The correct answer is 4. Cataracts. 28. A client's vision is tested with Snell chart. The results of the test are documented 2540. The nurse interprets this as 1. The client can read a distance of 40 feet what a client with normal vision can read at 20 feet. 2. The client is legally blind and glass or contact lenses will not be helpful. 3. The client vision is normal but the client may require reading glasses. 4. The client can read distance of 20 feet what a client with normal vision can read 40 feet. The correct answer is 4. The client can read at distance 20 feet what a client normal